Welcome back. Well, all too often patients are afraid to ask their doctors questions. Sometimes it's out of fear that they'll offend the doctor. Other times it's just a lack of knowledge. Well, here to tell us how we can be our own best advocate, welcome Dr. Melanie Palm. Good morning.
Hi, Brooke.
All right, this is a huge topic because all too often people go in and they just let a doctor that they don't even know inject whatever it is, and they don't know what's being put into their body. What would you suggest we do, and what are the real problems here?
Yeah, and I think it's also medicine in general. So I really welcome informed patients. Come in informed into the office. Ask them. There's no good physician that is going to be put off by questioning. So I always tell patients, ask about training of the physician. Are they board certified in the area that they're performing the expertise? If it's something really specialized, have they done additional training such as fellowship training? And how long have they been doing it? Have they done this on a lot of patients, or is this their first few?
So you were telling me that it's important to not only ask what's being injected, but you can also ask to see the label.
Yeah, and I have patients ask, for example, if we're doing a toxin such as Botox or Dysport, ask to actually see the box. So I actually brought some of these products. If you take a look at it, and we'll talk a little bit about distributors, there's actually only 3 companies that distribute all of the fillers and injectable toxins that we use in the U.S. And so your physician should only order from one of those 3, Allergan, Galderma, or MERS.
Okay, so if it's anything outside of that, and we're talking about dermatological procedures for this, anything else other than those 3 products, then you may not be getting something good for your body.
Yeah, there's alternate channels, and so I'm always weary when patients tell me about some sort of really lowball pricing that they've heard out in the community, because what that often means is that either the injector is getting gray market, meaning that they're importing sometimes valid product from Canada, Mexico, Europe, but you don't know how it's been distributed, you don't know how the product's been handled. So there could be bacterial contamination, there could be temperature issues, and even more scary, I've had patients that have gotten injected at parties at somebody else's home. They don't know the injector, they don't know what was injected, and sometimes this is product that's not even approved in the U.S. and things that can cause real problems down the line.
And if it is at such a low cost, it could have been sitting in some mass warehouse with other products where temperature's not even controlled, right?
Yeah, and that really can compromise the product. And, you know, there's also a growing trying to sort of save on costs. There are some physicians that even co-op together. They actually order through the appropriate companies, but they order to one office, and then it's distributed from there. And so you don't know what happens in that transit time. So again, that's a way it should be compromised. Your physician should just be ordering itself from these 3, and ask to see the box. On all of these products, there's a hologram either on the box or on the vial itself. That's the case with Botox. On Dysport, it's on the outside. Take a look at the lot number. It also tells you the expiration date. It obviously shouldn't have passed. And with a lot of these, I'm always happy to take it out of the box, show it to the patient, or even mix it up fresh right in front of them prior to injection.
So one of the biggest points today, and one of the takeaways, is just don't be afraid to ask the doctor to do that. We think we're going to offend them, but it's not necessarily offensive to you as a physician.
You know, I think for a long time, sort of medicine was sort of a paternalistic relationship between physician and patient, and I really welcome well-informed patients. Do not be afraid to ask things, and if in your gut something seems off, don't be afraid to leave.
Okay, thank you so much, and we're going to have you back again at 10 o'clock. There's so much to talk about with this topic. Thank you.